Well, I'm Emily Smith Goering, and I'm from the Center for Adoption Support and Education. And I'm here today to talk about some work that we've been doing to support permanency through adoption competent mental health services. This is a project called the National Adoption Competency Mental Health Training Initiative, also known as NTI. It's part of a 5-year federal grant, so we'd like to just thank the Children's Bureau for that opportunity. And really it emerged out of this need that was identified. So in 2016, the Academy of Pediatrics identified mental and behavioral health as the greatest unmet health need for children and teens in foster care. And what we know is that children who have been in foster care, children that have been adopted or achieved guardianship, are seeking services at higher rates than the general population. But what we also know is that these children and parents are reporting this need for specialized services. So when they access services, they're not getting their needs met in the current mental health systems because there isn't really this specialized training. This is just one example of a young person that shared, I was sitting in the hospital after trying to kill myself, and the social worker lady told me I should be happy that I was adopted, as my parents had gotten me out of the horrible orphanage. So it really just demonstrates a real lack of understanding from that professional that was working with this young person. And so we really want to address this need of systems change for children and family. We believe that when child welfare and mental health professionals speak a shared language, they're better able to collaborate to serve adopted children and their forever families. So what we've been working on through our project is to create, deliver, implement, and evaluate training for child welfare and mental health professionals. And so that's what I'll be talking more about today. We have developed 2 trainings, one for child welfare professionals and one for mental health professionals, and these are comprehensive in-depth trainings. So these are 20 to 30-hour trainings with 8 to 10 modules. They are interactive, they're not a passive training where a participant can sit back and sort of listen, they have to engage and participate. And on the child welfare side, it's this more clinical, or this more casework focused training, whereas on the mental health side, it's clinical focused on assessment and treatment. So these are companion trainings. The competencies, as you'll see when I go over those, are aligned, but they're for different audiences. So what we want to do with our training is provide these practical skills and resources that help this population and that help our professionals treat this population. So you'll see from this image here, it doesn't really help a drowning person if we just hand them a bar of soap. We want to be able to provide clinical and practice-based skills and resources to build professional toolboxes to address the needs of this specific population. And it's really about that competency and skill development to enhance permanency and well-being. So just to talk really briefly about the target audiences, and we'll talk about who we've been piloting the training with. Our target audiences on the child welfare side, it's really any child welfare professionals working for state systems or private providers, contract providers. The clinical side has been, the mental health professional side has been even more broad in terms of who's been utilizing the training. So we define it as anyone working in a clinical capacity with children and youth who have been in foster care or been adopted or achieved guardianship. And these people can be in private practice or other community-based settings, so there's really a wide range of participation. And here you'll see the competency. So we first start with understanding the children's mental health challenges for this population. We talk a lot about loss and grief specific to foster care and specific to adoption. We talk about trauma, attachment, positive identity formation, and then we have a really important module on understanding the impact of race, culture, diversity in adoptive and guardianship families, and then this permanency piece on post-permanency, post-adoption supports that are needed. And for the clinical side, we do have more content on assessment and treatment planning, and a module then on therapeutic parenting strategies as well. So I want to talk about our evaluation that we've done. We piloted this across 9 sites. We've had 8 states participate and 1 tribal mental health and child welfare system, which is the Cherokee Nation in Oklahoma. We piloted with over 6,000 child welfare professionals and almost 3,000 mental health professionals. And on the child welfare side, we saw a 72.5% completion rate, whereas on the mental health side, there was a 69% completion rate of the training among those that actually started NTI. So we were really pleased with those completion rates because for a comprehensive training that really takes that much time investment, these completion rates are much higher than we would have expected to see. So we had a qualitative and quantitative component of our evaluation. We first looked at knowledge gains, and this chart here is showing child welfare professionals' knowledge gains. So the pre-test scores are in blue, and the post-test scores there are in orange. And we saw really on average, pre-test, no one was really passing. There were really low passing rates. Pre-test, the average scores were very low, but we were pleased to see the statistically significant knowledge gains across all of the modules. And you'll see here we highlighted that the module with the lowest pre-test scores was that module around loss and grief. And this is really important for this population, that our professionals are understanding the unique loss and grief that comes with foster care and with adoption. But more importantly, we wanted to understand how was NTI being applied in practice by these professionals. So child welfare professionals were asked to respond to a qualitative piece of the evaluation around how they were applying this content in practice post-training. And we identified several themes, some around recruitment, training, and selection of foster parents and how that had changed, improvement in assessment and referrals, and so many reported evidence-based practices that they were now referring their children and families to. There was more honest communication and understanding with youth and caregivers, so we heard a lot of professionals talking about how they didn't understand that they needed to really explain why the child was removed from the home or why an adoption occurred. And then this really important finding around improved confidence and self-efficacy for the workforce. And then on the mental health side, I'll just briefly go over this as well. Again, there were really low pre-test scores, average pre-test scores. And for this audience, they were even lower, and really struggling around those modules on attachment, race, ethnicity, culture, and diversity, and identity formation. But again, post-test, we were seeing statistically significant knowledge gains across all of our module content. And the mental health professionals reported to us in the qualitative piece as well, how they were using this in practice. We saw some themes emerge around their increased competency and knowledge in certain areas, but more importantly, some really specific ways they had changed their practice. So they reported improvements in advocacy, attachment, their work with birth families, developmental impacts of adoption, grief and loss, involving parents, psychoeducational, trauma, and adoption competent language. And then they also talked about disseminating this NTI knowledge to others in the field, to other professionals. They changed assessment in a lot of cases and were able to name some really specific interventions and strategies from the training that they were now utilizing. And because of these really great ways that we saw the training impact in practice, we weren't surprised to see overall really high satisfaction rates. Also just reporting high levels of satisfaction with the training itself, with the ease of use, the level of interaction and difficulty. Lowest here was on overall length, and really it does take a significant time commitment, staffing time commitment, and so that's something that we talked about in the implementation piece as we implemented this. So the overall goals, again, NTI is really about providing skills and strategies and tools to ultimately improve child and family well-being and increase family stability. And that would be the next phase of evaluation that we would hope to do as we launch this nationally, is really look at how did this impact the children and families that are now served by these professionals. So in 2019, we are excited to launch this training. It's going to be free to all states, tribes, and territories. And if you'd like to talk more about it, we have a booth here that we'd be happy to talk to you all about. What are the real keys for how you implement this? As the last person spoke about, that implementation piece is really key. And so we would love to talk to anyone that's interested in NTI. And also just a brief thank you to all of our partners. This work wouldn't have been possible without a lot of partnerships and advisors that were speaking into this project. Thank you.